First, we're going to talk about Representative Ro Khanna and Senator Elizabeth Warren's team up on legislation. So, Ro Khanna and Elizabeth Warren made a trip to legislation to propose a federal essential workers Bill of Rights to demand coverage in the next stimulus package for frontline healthcare workers. This bill details about 10 rights that should be given to workers, such as healthcare, childcare, worker safety provisions, bolstered workplace protections, oversight of employers, and safeguards for whistleblowers to allow employees to report unsatisfactory work conditions, universal paid sick leave, and family medical leave. Now, many have commented on the essential workers who have become the backbone of America during this crisis. And, we've all seen the memes about how people in essential working jobs are commenting on how their jobs were deemed as high schoolers' jobs and not real jobs until they became essential workers. And this tweet from Jake Merch that talked about his letter that says he's an essential worker, but his paycheck that says otherwise. Now, this connects to how many essential workers are not receiving pay that is sufficient for them or to support their family in times of need. Many essential workers are struggling due to fear for their safety as well as their families, and they have no choice but to take this risk for a minimum wage paycheck. Right now, America is not currently designed to protect its most needed workers in times of distress, which is why extra rights, protection, and pay is needed. This brings to light the call for hazard pay or a stimulus bill for frontline workers. Next up, New York City is to manufacture its own coronavirus testing kits. Mayor Bill de Blasio has stated that New York will begin manufacturing its own testing kits from its factories and an Indiana-based company. The mayor has also stated that New York has locked down a supply of 100,000 tests per week, and it will produce and buy 50,000 more tests as well as masks per week. Now, a massive problem with testing has been the lack of a way to get widespread testing, as they're not available on the open market despite lots of scouring. Drops in coronavirus testing, especially in New York, are most likely from a swab shortage, as the tests are essentially cotton swabs that are being stuck in the noses of suspected patients. As gross as that is, that connects to a bigger issue, which has been a massive shortage of supplies across the country. The swab shortage is one example of this, where many are being prompted to donate medical-grade masks to local hospitals and to make their own masks at home. Protective gear like masks, gowns, gloves, and ventilators are desperately being rationed, and they're basically in need. So a quick PSA, I'm definitely not the first to say this, but if you have extra medical grade equipment like masks and ventilators and so on, gloves also, you should be donating them. It's easy to hoard. It's easy to go to Costco and buy like the 100-pack and stock whole closets with. But keep in mind that you probably don't need all of that, especially since there are people who are actually on the front lines who are more at risk, who need these same materials. Oh, we interrupt this regularly scheduled program to bring you a brief question. Trump said when somebody's president of the United States, the authority is total. Is he correct? I'm going to give you 5 seconds. Actually, you know what? I'm going to cut that short. No, he's not correct. He's not even close. The Constitution has explicitly stated that the president does not have total authority. From some quotes from a source I have, the federal government does not have absolute power, said Representative Liz Cheney from Wyoming, who went on to quote the text of the 10th Amendment in a tweet that went viral. Next up, our final source, this one is local, Fremont, has now introduced its free COVID-19 drive-through testing center, and it has tested 715 people in the first week. Finally, we've done something right. Now, it examined 715 people, with 37 people showing positive results. It had turned away about 200 people who approached for not being legitimate suspected patients. By the way, to get tested, you must be showing symptoms. Don't show up if you have a hunch. Having a hunch is not a good reason to get tested. The testing is free and will be given regardless of immigration status or residence. So I guess the question is, why aren't more cities doing this? Now, I don't know much about the testing. I don't know what kind of service it's giving. Hopefully, the drive-thru is more of a Chick-fil-A status than McDonald's status, if you know what I mean. But we should be doing this because A, the testing is quick and easy. 2, it protects others from being exposed to the coronavirus. And 3, it's way faster when it's free. So basically, it gets people tested in a quicker time and in a safer way. So in conclusion, let's get on that.